Hi, Dr. Heather here from Wellspring Chiropractic Lifestyle Center. Today we're talking about disc injuries and tests that you can do to determine whether or not you do have a disc injury. The classic test we go to first is the straight leg raise, otherwise known as Lasag's test. And so this is done by lying on your back and then having somebody lift your leg, keeping the knee straight and keeping the foot flexed so your toe is going towards your nose, and you're going to just lift the leg up straight, keeping the leg straight, lifting it up, and watching the degrees of at what point it may reproduce pain. So we always like to start with the leg that is not the side of the symptom and see if that reproduces any pain, and then we can switch to the other one. Anytime we find that pain is reproduced, either in the low back or going down into the leg, at less than 70 degrees, it is an indication that there may be a disc injury. If your leg can go beyond 70 degrees, but it still recreates pain, then it may indicate a sacroiliac injury or a sacroiliac dysfunction or a lumbar dysfunction, or also a hip dysfunction. And so then we would address that differently. So that's the straight leg raise. Another way to do a test is to look at posture, antalgic posture. So if you find that you are leaning off to one side because it's too painful to be upright and balanced, pay attention to which side you're leaning. If you're leaning into the side that has pain, it tells us about there being a particular location of that disc injury. And if you're leaning away from the side of pain, it tells us a different place for the disc. Another test we like to do is a heel-toe walk. And so we're actually measuring the nerves that control the muscles in the leg. And those nerves come out of the lumbar area, which is where there may be a disc injury. So we ask people to see if they can walk on their toes or if they can walk on their heels, because different muscles will be used in order to walk in those ways. And sometimes people find that they can do that maneuver, but if we ask them to stand on one leg and lift their toes, or stand on one leg and stand up on their toes, they'll notice that one side is weaker than the other. And so that could be an indication that there could be a disc injury. Now, in the office, we do some other tests as well to measure what is happening. These would include palpating the spine so we can feel where the vertebrae are restricted, where there's tenderness, where there's inflammation, as well as looking at ranges of motion. The ranges of motion will show us where there's restrictions, where there's guardedness. And then we also like to use imaging. Now, x-rays can tell us something, but the best way to get imaging to look at a disc concern is actually using an MRI, because the MRI literally can show us the disc tissue and whether it is herniating or bulging out, and exactly where, which nerves it may be putting pressure on. It is interesting, however, that MRI on its own would not be regarded as diagnostic of a disc injury. It has to be coupled with the other tests that we do. And the reason is that they actually did a study. I think they've repeated this study a number of times. And the particular one was where they took MRIs of people and they blinded the radiologist so he didn't know what the symptoms were. And when he looked at the MRIs, 50% of the cases, he said, yep, this is positive for a disc injury. And 50% he said, no, there's no evidence of disc injury here. And then when they looked at the symptoms, it turns out that 50% of the ones that the radiologist said, yes, this looks like a disc injury, had no symptoms. And 50% of the people that he said, there is no disc injuries here, they had all the symptoms of a disc injury. So we have to put the information together in order to actually use it in a diagnostic way. Well, I hope that you found that this was useful in understanding tests that can be done to determine whether or not there is a disc injury, because these are the very tests that we use to determine how we're going to help somebody. If you found that this was useful, please share it with others as well.